So, as far as treatments being tried here, you should know that there are 27, if not 31 actually, I think there are 31 now, research centers around the country devoted explicitly to trying to find a cure. The NIH tries to fund studies looking at prevention, looking at treating psychosocial issues, predicting Alzheimer's disease, and then treatments. I think UVA actually is one of those centers. So what I wanted to go through here with you are some of the things that have been tried over the years that have not really worked out. Many times what we see is we see a partnership between the centers like this and then drug companies looking to find treatments and cures. So if you go down the modules here, the first one we have are products to reduce amyloid. So amyloid forms, becomes the plaques, and one of the drug companies was trying to develop a product that might reduce the amyloid formation. And if you follow this down with this immunotherapy, focusing on a tau protein, if you read on Pfizer and company and Johnson & Johnson, never got past stage 2. Hopefully you know the stages of clinical trials. One is where you just test it out to see if it's safe. 2 is where you test it out to see if it's safe and effective on a small group. And the big one, the $1 million one, is the phase 3 clinical trial where you test it out. Lots of people, lots of different centers, randomized, double-blind, placebo control. And then if that works, you can get FDA approval to market your product. So this one did not work as one example. If you look at the next one with aspirin, I'm not sure if we went over, but I think we did the idea of a Cochrane review. That is actually considered the highest level of research-based, evidence-based review. They look at all the articles on the topic, and if you look at this one for aspirin, nothing. 604 studies. They basically found if you get to the endpoint, these studies have shown that the non-steroidals and aspirin don't do anything to help with Alzheimer's disease. The next one that was done, and this one was done some years ago, it was thought women don't get Alzheimer's disease as much because of estrogen. Estrogen is up in the limbic system area, and so it was thought maybe we could actually give people estrogen hormone replacement therapy, and that might help out. So they did this big study, the Women's Health Initiative. You can read the abstract there. The summary for it is if you get down towards the bottom, it didn't pan out. It didn't pan out at all. They actually had to pull the plug on the trial because some people started getting dementia. So the estrogen idea didn't work. The next idea, statins. It turns out that apolipoprotein ED4 is very related to LDL, low density lipoprotein, I think it is, LDL. And LDL, of course, is implicated in heart disease. So they actually gave people studies where they looked at statins for the treatment of Alzheimer's disease to reduce LDL, and they actually found that nothing really became of it, unfortunately. So not enough evidence to look at it. If you go down on the alternative medicine side, vitamin E, once again, a Cochrane database review, no good research showing that it is actually effective. And last but not least, and some of you may be familiar with this, ginkgo biloba. Once again, a Cochrane database review. Can't hurt really at the start of things, but as far as improving things, not too much there. So what you need to do for this particular assignment is basically go through, maybe copy and paste all these materials, write little excerpts after each one to show that you understand what I'm sharing acoustically in your own words with summaries, and that'll conclude this one. Your homework assignment is going to map right to a follow-up for Alzheimer's disease, and I'll explain that in just a minute. Thanks. Bye-bye.